This is take 8. Last time it just crashed, and I'm gonna try and cruise through this because it's getting to be 16 minutes long. So this is my final. I'm focusing on children in the Oregon's foster care system. My name is Tyler Regan. So population, social issues, and life stages. So, specifically focusing on Oregon's foster care system and the kids that are in there. Ages, life stages are anywhere from newborns to teens aging out. Um, and so, the social issue itself is obviously all that comes with being in the foster care system. So, what we know is that there's approximately 5,300 kids that are currently in Oregon's foster care system. That's as of 2022, actually. So slightly outdated. But 17.5% of those kids will at some point be moved to three different houses in the span of 12 months. So moving houses, changing guardianship, all these different instabilities are created. And there was a study done by Northwest alumni that showed 30% of adults who were in foster care had experienced PTSD and been diagnosed, and rape was actually the most common leading to the diagnosis of PTSD. So we know that early life stages are critical for developing trust, identity, and what that will kind of shape what success looks like throughout these kids' lives. And foster children receive drastically higher ACE scores, and we know that ACE scores lead to pretty detrimental health outcomes overall. So my motivation comes from starting a nonprofit called the TELUS Initiative, and we focus on enriching children's lives through extracurricular programs that are about 6 months long. And we also include kind of peer mentorship and like light case management, trying to address the kids' needs, ask them questions, see if they're liking what they're doing, if there's any way we can help, change programs. Do you need a toothbrush even? So kind of a lot of different spaces we occupy. And what's interesting is that we were looking to help kids in shelters, but after talking to people in community, there was a much bigger need to work with foster children. So our main goal with starting a nonprofit was to really focus on needs in our community, and foster care system needs were so much greater than anything we saw. So we pivoted and we've really started to work on that. And then I grew up in a tumultuous home, and I've always had a desire to work with kids and be a role model and a responsible adult in their life because I never really got that as a kid, which kind of furthers my motivations for Telos and this project itself. So, as far as challenges we see, like we talked about before, instability within, interrupted schooling, changing houses, you might have to change doctors, all the trauma that comes with poor caregiving as well in these situations, because many face emotional traumas and griefs, and this leads to behavioral challenges throughout the child's life, and those instabilities really exacerbate the issues at large. And then we know through these challenges that leads to a lot of negative health outcomes through just looking at ACE scores and stuff like that. And this kind of creates low life expectancies and more um, risky behavior in adulthood. So ecological systems was a really interesting one to view the foster care system through. And it's a great tool, it's a great theory to kind of look at these overall outcomes and how all these different systems interact. So, microsystems being the immediate environment, families, schools, caregivers, mesosystem being the kind of interplay and interactions between those microsystems. So, that could look like relationships between foster parents and the schools, foster parents and the doctors, all these different interactions. Exosystems are the indirect influences. So, what do child welfare policies look like? What does the foster care system look like? And how do they kind of go about transitioning kids into different homes and the adoption process and all that? So, macro systems are these larger social and cultural values. So, our public attitudes towards foster care. And what was really interesting about macro systems is when I was starting to talk to our community, it's such a delicate topic, the foster care system, and not a lot of people know about it. And so there's a lot of sorrow that actually pushes people away from engaging with the system in itself because there's a lot of trauma, there's a lot of poor care, there's a lot of behavioral elements to it that are really hard to have an understanding and create more empathy and compassion in. So macro systems has been a really interesting lens to view Telos through in the foster care system. And then we have the chrono system, which is the impact of time. So, as kids age out of the foster care system, what are these long term trauma effects? What do they look like? What can we expect overall? So, excuse me, we see that children experience a lot of disruptions across multiple microsystems. This could be due to frequent placements, underfunding that makes schools harder, doctors' appointments harder. Um, and then, what we do at Telos is try and create like strong mesosystems with our coordinated support between foster families, and the programs we implement like a lot of SEL and have brochures and how to engage and communicate through families and the foster children, and then just school and caseworkers and how these mesosystems can improve overall life outcomes. So really looking and trying to create strong mesosystems is super important. Exosystems are policy, can be policies. So Oregon's Foster Children's Bill of Rights is a big one, and it's really starting to enhance stability in foster children, and the care they receive, and also the advocacy for them. Macro systems, um, and like the factors such as social stigmas or biases against foster children can really influence opportunity and self esteem as well. So we're trying to at Telos shine more light on on the foster care system and the children that are in them, and really try and reshape social stigmas and these biases and approach these delicate conversations with more compassion and empathy. And then the chrono system itself can really help us, like we said, understand the long-term health effects of foster care transition, how it shapes resiliency, and what ongoing struggles may look like. And so the ecosystem really, it's a really in-depth, it can be if you take it this way and take it that far, but it can be this in-depth look at the holistic in a holistic way. So it's a really beautiful way to view this system through. I really loved Goldsmith's attachment theory and how she explained it as this emotional dance. And the basically there's these bonds within the caregiver and the adult, and if they're in sync, it creates a secure attachment. The caregiver is attuned to the child's needs, they provide comfort and safety, and it builds that bond and builds trust, and healthy emotional development can occur. Start to Healthy emotional development can start to begin. So, and what we see within foster care children is that they create these really insecure attachments, avoidant attachments, and that partially comes from that dance being disruptive. Caregivers are unresponsive, inconsistent. This bond is broken, and that child is left with an emotional void. And so this can lead to those insecure, those avoidant attachment styles. And kids can become anxious, they can become avoidant, disorganized in relationships overall. And Goldsmith notes that such attachment problems can manifest as behavioral issues, difficulty regulating emotions, and that just comes from this child not having a stable life or a caregiver that's attuned, the instability that comes from it. So foster youth really, they often experience this broken attachments, and being separated from birth from the very start is traumatic, and there's a lot of poor care that's given within the foster care system itself, and this disrupts that emotional dance. So many foster children end up struggling with trust. And so this can kind of look like them pushing away from people or being too clingy. That those actions reflect their attachment insecurities. And so what I was looking into a little bit was more attachment focused therapies and kind of stable adult mentors, and how that can help rebuild a child's capacity to form healthy bonds. And that's what I'm really pushing for, at least the adult mentorship part within Telos, and trying to really create these healthy bonds. So the future, outlook for foster children is trending upward in a lot of cases. And what we see is a 12.6% drop in children that are in care from 2020 to 2021. So, less kids that are in the system itself. And there's a growing emphasis on preventing entry into foster care. Um, and also finding permanent homes for children as well. And so there's things like policies like the Foster Children's Bill of Rights that ensures these kids and aging adults or adults who are aging out maintain these certain rights. So some of these things may look like focusing on keeping siblings together, honoring cultural connections. So new laws are being put in place as well to ensure resources for those kids aging out at 18 are included. They can remain in care until 21, and things like tuition waivers are made void for them so they don't have a lot of upfront cost or as much upfront cost. So we also, what I was finding is that future is moving towards more trauma informed and holistic care. And there's a plethora of nonprofits that are starting to train foster parents in more trauma informed parenting and attachment based care itself. And what I was kind of touching on before is that we implement SEL learning at Telos for the kids within our programs and the people that provide the programs, as well as providing booklets for foster parents and potential parents who want to adopt. And these booklets really kind of just create conversation and engagement within the kids and their guardians. And they interplay between the lessons that are learned at our programs and when these kids get home. Um, and then there's also alternative therapies like art or music therapy and mentoring programs that are starting to come out to help heal trauma. And one cool resource that I found was a school called REMS in Bend, Oregon, here that is an outdoor school. And they really curtail some of their academic planning towards foster children and create these more wraparound services for them. And there's just more community awareness that's increasing overall. There's organizations like CASA that help with advocacy and work with children as well. So on the flip side of that, statistic trends are kind of going upwards, and that can bring about hope, but there's still a lot to be done. And I had a really tough time finding in-depth research for foster children and adults alike. It was pretty sparse overall. So, understanding the needs and outcomes and all that comes with kids and the adults who have been in foster care, it's hard to find overall. So, ongoing research that's looking at these long-term outcomes for foster children through like peer mentoring, extracurricular engagement, culturally specific interventions. They're being studied, but they really lack implementation and funding. Um, it's a delicate subject, like I said, and funding is pretty sparse, especially in the world that we live in today, with current folks who sit in the White House. We won't go into that, but there are policies like the Family First Act, which hopes to reduce the need for foster care and improve child well-being. But this can also encourage further trauma if a kid's in a really poor family situation and like they unfortunately have to stay in these traumatic scenarios and situations. So, understanding theories like the ecological systems can really help address gaps and understand the gaps in foster care system and address the direct needs of the children and adults alike. So, my personal takeaways were understanding how instability and trauma affect foster children has really helped me define and go deeper into this kind of complex interplay of all the different ecological systems. And I hope that I can continue to utilize that framework as a lens in order to address the needs as I further tell us. And so, attachment theory on top of that really helped me to understand the struggles that these children may have with trust and identity, and how I can be a more consistent, trusted adult in there. in life. So my commitment to advocacy and the needs of these foster children has really dramatically and drastically increased. So um, it's been a really amazing thing to kind of dive into and research, and it's also given me a lot of hope and made me realize how valuable the programs at Telos are. And now my mind's been like just spinning and being like, okay, how do we fill these different critical gaps? Like, what's maybe missing? How can we strategically implement programs that like really bolster these kids' development overall? So I feel really motivated. I feel motivated to be a consistent mentor, to advocate, and also to like really dive into policies that have been implemented and learn more. So it's been a really great project and a really great term. So I appreciate everything. And that's it. Thank you.